Brian, every micronutrient ad seems to start with tiredness, brain fog, or brittle nails. But those symptoms are so common, and people hear them when they are already worried. How do we talk about gaps without making people think every off week, stressful month, or bad sleep streak means they need a bottle?
The safer frame is, deficiency is a pathway, not a vibe. A nutrient has to show up in the diet, be absorbed through the gut, transported in blood, stored or activated, then used in tissues. A gap can happen at any step. Low intake, low dietary diversity, pregnancy needs, infancy needs, gut disease, inflammation, blood loss, or medicines that change absorption. So I'd map 5 things before supplementing: the eating pattern, the person's life stage, absorption or medical history, medications, and a biomarker when one is available. That is boring compared with a miracle claim, but it predicts who actually benefits much better than guessing from a symptom list or copying someone else's stack.
What patterns would make your ears perk up? Not in a judgmental way, but if someone says vegan, mostly ultra-processed snacks, very little dairy, very little seafood, or just the same 3 meals every day, what are the first gaps you would at least consider before deciding whether testing or food changes make sense?
Exactly. Very low animal source intake raises B12 risk because reliable B12 mostly comes from animal foods or fortified foods. Low iron intake matters more for menstruating or pregnant people because demand and losses are higher. Little dairy or fortified food can lower calcium, iodine, or vitamin D intake depending on the country. The point is targeted suspicion, not panic or a universal multivitamin prescription.
But what if someone eats healthy and still runs low? Is that where absorption, inflammation, or blood loss can make the plate look better than the bloodstream? I'm thinking of people who do everything carefully, then feel blamed when the real problem is a gut condition, heavy bleeding, or a marker that is hard to interpret.
Yes, and that is why high-dose self-treatment can be messy. Iron is a good example. Too little is harmful, but extra iron when you are not deficient can cause side effects and may be unsafe in some conditions. Ferritin, hemoglobin, inflammation markers, blood loss history, pregnancy status, and the reason anemia is present all matter before deciding dose or duration. Population data also remind us that gaps are not evenly distributed. The Sierra Leone review found anemia exceeding 60% among children under 5 in available data, while vitamin A deficiency was reported at 17.4% in one national survey. Those numbers describe a setting with specific food access and health conditions, not a universal supplement rule for every viewer.
Infants seem different from adults, though. Vitamin D is one of the few cases where I hear fairly direct advice, especially for babies who are breastfed or have limited sun exposure. What does the evidence say for term infants? And where does it become less certain than the confident parenting posts make it sound?
A recent review says daily 400 IU vitamin D maintains adequate 25-hydroxy vitamin D levels in most healthy term infants. Some infants at higher risk, like limited sunlight exposure, darker skin pigmentation, or northern latitude residents, may need more under guidance. But claims about immune modulation or respiratory protection beyond skeletal health are still inconclusive because trials differ in baseline status, dosing, and adherence. Pregnancy is another high-demand state. An health review of randomized trials found most phone-supported nutrition interventions improved hemoglobin in pregnant women, though the studies were very heterogeneous. The lesson is not that WhatsApp cures anemia. It is that reminders, counseling, access, tolerance, and adherence can change whether iron programs work in real life, not just whether the tablet contains iron.
So if someone is pregnant, trying to conceive, has heavy periods, kidney disease, inflammatory bowel disease, or a history of bariatric surgery, is this firmly in clinician-guided territory instead of try whatever the internet recommends territory? It sounds like the same pill can be reasonable, insufficient, or risky depending on the body receiving it.
Yes, and zooming out matters too. In African drylands, a systematic review found livestock can support dietary diversity through milk, animal source foods, and income. But benefits depend on mobility, markets, gendered control of income, and season. Wet seasons often improve diet quality. Dry seasons can worsen food insecurity and child wasting. Micronutrient gaps are biology, but also food systems.
For someone shopping in a supermarket, how should they use labels without turning breakfast cereal into a chemistry exam? Are percent daily values actually useful for finding fortified foods or spotting when a product is basically a supplement in disguise, especially if they already take gummies, powders, drinks, or a prenatal?
They are useful for comparison. If a food supplies a meaningful percent daily value for a nutrient you rarely eat, that may be practical. To judge health, choose the right outcome. Ferritin and hemoglobin for iron deficiency, 25-hydroxyvitamin D for vitamin D status, growth or pregnancy outcomes where appropriate, and symptoms only as supporting evidence. If the marker does not move, change the explanation. And dose matters. Water-soluble does not mean consequence-free, and fat-soluble vitamins can accumulate. Minerals can also compete with each other or interact with medicines. If a product stacks high doses across multiple pills, energy drinks, fortified cereals, powders, and fortified waters, the risk is no longer theoretical. Bring the full list to a clinician or pharmacist, not just the bottle you remember.
So the rule is not anti-supplement. It is anti-guessing, right? First, ask what the pattern predicts, what the body might fail to absorb, what life stage demands, what medicines change, and what lab or outcome would prove the plan is working. Then food, fortification, and supplements become tools instead of a personality test.